what is the most appropriate from someone based on their lifestyle needs, the requirement for the services that they need, and also based on financial. So, it doesn't make sense to pay for something you cannot afford, and then it provides you all these services, it pays for all services that you're not going to need. But there are also rules, and they need to understand the rules. So I can better communicate that, and I know that my competitors, they can only talk about what's the lowest cost, what's the lowest premiums. That's just what they would present, and so. But for my end, what I talk about is that okay, here's your health plan, and this is how you're going to use it so you stay healthy. And what I tell my clients is that, well, think about it. If you are going to see your doctor and it's not a checkup, remember you see your doctor once a year for checkups, but if you're going to see her 5 times more and it's not a checkup for something preventable, think about it. You're now going to pay for your deductibles and your co-pays. Don't you save money if you stay healthy? And they start to see it that way, especially some of the seniors. They start to understand how to use it because by staying healthy, they don't pay a lot of co-pays. They minimize their out-of-pocket costs. So I start to educate that way, and I start to enjoy it. Plus the fact that some of the skills that I brought with me, to be honest, is the data integrity. If I enter the correct data all the time, I understand how databases work. And if I put them correctly, and if something hits incorrectly, I know what happened. I know what to do. I know who to call. I know when to open a ticket because the system doesn't seem to be doing it correctly. Because I did the software business analyst, so I could tell if the system is built well. And this is what I know too. Um, those who develops their systems are very open to improving it, and they rely on people who use it. But if you don't say anything about it, it's not going to be fixed. And so I've always called and I've always tell them, you know what, you have to fix it. It's doing it this way. And they're very receptive to it and they will update it. But that's how I got here. So right now, before I used to write a business plan for the hospital. Right now I'm writing for my own. And everywhere you go, it's always the execution. So,